Hello, everyone. We're so delighted that you joined us for the Lymphedema Patient Roundtable. You are logging on. Some of our panelists are still logging on even right now, but I just want to welcome you. This is your place. It's your safe space to ask questions as a patient of other patients. We're also honored to have medical experts here too that can answer your questions. We don't offer medical advice, but we sure are here to encourage you in your journey as you manage your lymphedema. Many of you have a Lymphopress, and I'm Brenda Viola from Lymphopress, and I'm honored to be your moderator for every roundtable. And I'll do some quick introductions while people are logging on. We already see we have several participants that have joined the call, and I do want to acknowledge Annette Griffith and Bethany Knoll and Kathy Coyne and Donald Blue and our friend Jeannie Proctor, so many of you wonderful names out there. Christy Curry, who is my colleague at Lymphopress, is out there tonight, and Charlene Baskerville, Susan Montgomery, Terry Zins. Thank you. We know your time is valuable. So you're saying, Brenda, get on with the introductions. Okay, well, I hear you. I hear you. All right, Kelly Bell, veteran fighting lymphedema, who has actually made some changes to his diet that we'll talk about tonight. Angela Jones, lipolymphedema patient. She is a health and wellness coach. And we want to talk more about what she does and what her vision is to help people with wellness tonight. Angela, thanks for being here. Betty Westbrook, we have missed you these last few months, and you look adorable and camp ready. Tell us about your outfit.
So my Camp Watch Me uniform. It's my overalls and my camp shirt and my Bryland's feet hat. So this is my favorite outfit, and I love getting to break it out when it's close to camp. We're less than a month away. In a month today, we will be at camp with a lot of people. We have like 85 people in our groups total this year. So we have a big group this summer.
I think everybody had missed it for the last couple of years. And I know that the next person I'm going to introduce will be an attendee and a volunteer. Alexa Ercolano, great to see you tonight.
Great to see you too. Great to see everybody tonight.
Of course, Alexa has to see me every day, all day long, because we are like this. We work together at Lymphopress. Anything you see on social media, Alexa has built it and created it. But aside from that, she has a very awesome blog called The Lymphy Life that encourages so many lymphedema patients. We invite you to check that out as well. And Karen Ashforth, who is a medical expert for us, a pneumatic compression therapy expert, a brilliant teacher, an expert in fibrosis, and all around one of the nicest human beings you would ever want to meet. Karen, it's so nice to have you here tonight.
Thank you so much, Brenda. And I just want to announce that I'm starting my birthday celebration early. Tomorrow is my birthday. So you guys are all helping me start.
Well, yay.
Happy birthday.
Happy birthday to you. I would sing, except everybody would immediately log off, and we don't want that to happen. But please do, if you have questions for any of our panelists, put them in chat. We'd love to address them. Put them in the Q&A. If you have questions there. We heard some feedback this last month that they wanted to talk more to the patients. So patients, be ready for questions. Again, we're just offering our own personal experience and what we do know, especially about Lymphopress too. So with that, Karen, happy birthday to you. And Jeannie Proctor and several others in chat are already saying happy birthday to you. We appreciate you. This past weekend, Karen and I tag teamed a presentation for lymphedema seminars, which is given to therapists to help them enhance their skill set and their knowledge base. And it was so fun. We did like a David Letterman top 10 list of 5 things that therapists love about Lymphopress, and I came in with the 5 things patients love about Lymphopress, and it was so much fun, and I think we're going to have to do that again. But off the top of your head, what were some of the things that therapists love best about Lymphopress, Karen?
Well, I think the top one is that it makes everyone look good. It makes the patient look good because they're able to really manage their swelling in a powerful way. And it makes the therapist look good because we're doing our job right by helping our patients get an effective home program. So I would say that's one of my favorite top 5s.
I love that. And I also jumped in with one of my favorites, which is it works. I mean, you use something if it works. And if you're seeing your legs reduce, you're seeing your mobility increase, you're getting your quality of life back. It's sort of like, okay, I'm going to keep doing that. And compliance is such a key. If you don't use it, if you don't manage your condition, it's sort of like brushing your teeth every morning. It's something that you have to do, or you should, for goodness sakes. So I love the fact that when you do it, you get results. So that's my little Lymphopress commercial. Let's talk camp for a minute. So Betty Westbrook, and Blanche Pepitone says, and it's easy to use. And we love that, because if it's easy to use, you're more likely to use it, and then you'll get the results you need. Yep. Well said, Blanche Pepitone. So for those in our audience that aren't familiar with Camp Watch Me, tell us about the special population that this focuses on, Betty.
So Camp Watch Me is intended for children with lymphedema. And one thing that I think is really special about camp, I think a lot of things are special about camp, but one thing I think is special is that it isn't a summer camp where you send your kid off for a week or two and then they come back and they tell you camp stories. It is a camp also for parents. So we encourage every child to bring an adult. And by encourage, I mean it's necessary. And so the parent comes with the kid. It can be a caregiver. It could be a therapist. It could be grandma. It could be biological parent. It could literally be any adult who is going to be an active participant in that child's management. And so when they come to camp, the kid gets to be a kid while learning about lymphedema, while learning that there are others with their condition and treating them. And so parents get to come to camp and they get to take off their parent caregiver hat and hand it to a CLT, because we have a CLT paired with every camper. So for the duration, the camper gets one-on-one treatment with a therapist. The parent gets to ask those one-on-one questions. And so that's who it's for. And then just the secret sauce with camp and just how we formulate activities and education and team building and support group. We really try to address the whole person, not just the physical of their condition.
I love that. And I have to say that Alexa is super excited to participate this year. And Alexa has lymphedema, has had it since she was a child. What would a camp like this have done for you back when you were just a little one dealing with this diagnosis?
It would have honestly changed my whole vantage point of what it means to be a person with lymphedema. As a kid, I was born with it, but I wasn't diagnosed until I was 14. And I have a twin sister who has no lymphedema, little skinny chicken legs. So constant built-in comparison there. And so to be able to see kids that looked like me, you know, I was teased as a kid. I was called, you know, cankle and big leg and all that stuff. Getting to see kids that were like me and knew what I was going through and knew what it felt like to have to ask for 2 different size shoes at the shoe store, you know, and all that stuff. It would have changed a lot for me. It would have been so meaningful. My family too, because they were so burnt out going to all of these different specialists and all of that, and no one had any answers. So I love what, you know, Bryland's Feet and Betty are doing. And I've never been to camp before, even as a kid. So I'm very excited to go this summer to camp for the first time. But it's just amazing. I know I'm going to get emotional when I'm there, because it's such a beautiful gift that you're giving these kids and their families by organizing it. So
Yeah,
Alexa.
it really is. We appreciate it so much, Betty. And we wanted to take time to talk about that today. And Lymphopress is so proud to be one of your sponsors, and we are proud to support this. And then having Alexa, who will be our intrepid reporter on the site, being able to post some social things, that'll be really good too. So you said, Alexa, that there might be some emotional moments, and let's be real, dealing with a chronic illness, for everyone who's out there watching tonight, who's cared enough to join us, you know that you face your emotional challenges too. And part of the reason we do the roundtable is to support you in your journey, not just to talk about pumps or vibration plates or compression, and all that stuff is important, but also to acknowledge the fact that sometimes it's important to link arms with each other and to just know that you're not alone. That's why we do these roundtables. And so it is May, which is Mental Health Awareness Month. And we wanted to take a moment to acknowledge the fact that there's no shame in being candid and vulnerable about the fact that you might have some bluesy days. And I see you sort of nodding, Angela. Did you want to weigh in on some of those challenges? You know, the fact is, we want you to be able to see yourself in our panelists. It's not just me moderating. And let me tell you, I have my challenges too. We all do. We're human beings. It's part of the human condition. You're going to face emotional lows, but you don't have to stay there. And we're here to encourage you not to stay there. How do you manage your emotional lows, Angela?
I just have to get quiet, and I really have to tell myself it could be worse. I really have to say that I have a tendency to overdo, and with lipedema and lymphedema, they're constantly jockeying to be the most important. So yesterday I decided I was going to go for a walk at the park, and I bought myself an Oculus Quest virtual reality. And I decided I was going to work out, which I did for 1 hour and 40 minutes. That's not good. So I've been really, really tired all day. And I've been really down about it because I thought, here I was doing something really good, but it wasn't good for me. So it was a reminder, you know, push yourself, but don't push yourself past the limit, past the boundary that you don't need to go past. So I just really have to, you know, I have to realize their boundaries, and I have to realize just be quiet, like I'm going to do now.
I love what you just shared. And I have to ask, during the time that you were exercising, was there a point where your body was telling you stop and you kept pressing through? Or was it after the fact that you're like, I overdid it?
Well, to make a long story short, I don't know who's familiar with that particular virtual reality, but you have other people on what you call a leaderboard, and you get points when you beat these targets and you're doing all this exercise. So you get points. Well, there are 2 other people on my leaderboard and we're competing. I don't want to think we're competing, but we are. I pushed myself really because I wanted more points than the other 2 had. And I
totally get that.
And it was a reminder to me, don't compare yourself to what these people have or what they're doing. You need to remember what you're capable of, and you need to do that. So it was a good reminder. I just have been exhausted all day long.
Oh, well, Angela, first of all, for being exhausted, you're still amazingly awesome. And you just said something really powerful there, because when we compare ourselves to other people, whether they have lymphedema or not, whether they're in the same station of life as you are, comparison is the thief of joy.
Mm-hmm.
You know, we can't look at these airbrushed people on Instagram and expect to feel good when we look in the mirror. If that is our image of a certain standard, right? And I have embraced this concept of understanding that I am flawed, but I am awesome. I'm flawsome.
Awesome.
And we all should embrace our flawsomeness and, hey, have at it. Be at the leaderboard, but I'm going to feel good later. That's a really great point. Angela, thank you for sharing that. I appreciate it. Kelly, you wanted to weigh in.
Yeah, I think one of the most important, one of my struggles was when this all kicked in was I always wanted to get back to who I was before. And that was my struggle. That was my anger. That was a focus of my anger, because I was like not getting there no matter what I did. And you have to realize you have a medical condition. You're battling something, and learning to accept who I was and living in this moment is what found my peace. Now, I'll always work to try to get back there. But if I don't, I can't let it frustrate me, because my body does not function like the other millions of people that don't have lymphedema. So I think that's finding your peace with finding who you are at this moment right now and working just to make yourself healthier.
And not beating up on yourself.
Right.
Or feeling bad about where you are. And you just raised the flip side of this comparison thing, because sometimes we compare ourselves to other people, but sometimes we compare ourselves to where we used to be.
Right.
You know, my life today is completely different than a year ago for reasons that I had no control over. And yet, if I look back and say, well, that's when life was good, I miss the beauty of life today and the gifts that are all around me. There's always something I can appreciate. So thank you for raising that too. We don't just compare ourselves to other people. We compare ourselves to ourselves and who we used to be. And, you know, this topic of mental health has been on your heart as well, Betty, hasn't it?
To my unmute button. Yes. I spent a long 4 months away from the Lymphedema podcast because I had a little emotional breakdown as a CLT in a podcast interview, actually with a sponsor, and had to take a second to kind of excuse myself and tell them like, hey, I'm really sorry. I didn't know I was going to get emotional telling this story because I had realized I was holding a lot of grief from a patient that turned friend that had passed away. And I often think as a CLT, when I think of previous patients, I'm always thinking, oh, wow, this thing I'm learning about today could have helped them. Or, oh, I want to call so-and-so and say, hey, I've got this new product I've just learned about. This would really help you. And so we were talking about this particular product and I just kind of lost it. I looked up at my computer date and it told me the date, and it was the 1-year anniversary of her passing, and it just kind of all hit me at once. So I dedicated this new season of the podcast on mental health and emotional wellness. I did a whole series on grief. I interviewed a professional counselor with experience in this area and talked about it from the patient, the provider, the parent, and the partner's perspective, because grief is one thing to talk about. It's a form of, you know, mental health that we kind of carry, and I didn't know I was carrying that.
Wow.
And from that and some of the other episodes from the first month of this new season, I was invited recently to participate in a new project. I mean, it's super vague, and I hate that I have to be really general about it. But it's about mental health, and it's about the lymphedema community and how it's affecting individuals. And I'm excited that I was invited to do it, but I am so proud that the conversations that we have all been having, what I feel like has been in the last 6 months or longer, they're getting attention and they're being heard, and people are not just seeing the physical condition of lymphedema, but they're seeing that it's affecting mind, body, soul, the whole person. And that plays a part in how we respond and how we approach treatment and approach others. So yeah, it's been really big in my world lately. I know it plays a big role in the people who are living daily with lymphedema.
Yeah.
But as a therapist, I just want to say to anyone watching or listening today that you're not alone. I am here to be an ally and a friend and a voice. And there's other people out there who are seeing your struggle and hearing your struggle. And we want to help you as much as we can.
Yeah. And we do. First of all, thanks for being vulnerable there and sharing your own personal experience, because it's one thing to say, yeah, you know, you might be dealing with it, but you know what? We can all be dealing with it, and there is no shame in acknowledging it. We do want to let you know that we can answer your questions. We would love to hear from you. If you have a question for our medical experts, please put it in the Q&A. We would be happy to answer. And I have to say, probably Karen, you could speak to this as well. When we are dealing with emotional strain or stress, how does that impact the lymphedema?
Oh my goodness, Brenda, that's such an amazing question. And I love that we're off on this topic because the mind and the body are so connected. And when there's emotional turmoil, the muscles tighten and the breathing constricts, and all these things happen. All these chemicals are released that change our whole body chemistry, and it definitely impacts the lymphatic flow in our body. And when we're happy, when we're open, when we're moving and taking deep breaths in life, then our whole lymphatic circulation changes again for the positive. So I have to say that it's not about being happy or unhappy, but letting emotions flow and being authentic and being able to be in touch with what's going on, because we all go through things, and it very often does impact lymphedema.
Wow. I'm so glad that you shared it from a very practical and clinical aspect as well. It's like, give yourself permission to feel and don't be afraid. You know, there are days where you just need to have a good cry. That's your body's way of releasing some of that tension. So some of you out there are saying, what, can we please talk about a compression? Or, hey, and we'll talk about anything you want to talk about. I want to welcome Katherine Rosenberg, who joined us a little bit late. How are you doing, Katherine?
Doing okay. How are you?
I'm good. And I mean that, although there have been times this week I wasn't good. And now I'm back again, you know, and sometimes just meeting with my friends here helps to encourage my mood. So I appreciate that support system myself. Anything new to report in your world with regard to your lymphedema, Katherine?
So I just wanted to touch about the mental health situation as well, that sometimes as patients, you know, we understand where we're coming from in terms of how a situation may hinder or hurt us as patients. But unfortunately, sometimes people who think they're being helpful are actually being more hurtful to us without really knowing. So as I know I've talked about numerous times over the past couple months, I've been struggling with my lymphedema more and more as I'm waiting for a procedure to be done. And recently at work, people keep coming up to me going, "Are you okay? You don't look like you used to look 3 months ago." And I know they're trying to be thoughtful, but at the same time, it's one of those things that tends to be very hurtful, because unfortunately my condition is changing not for the better right now. So, and that's one of the things that not only do your friends and family may not realize, but unfortunately sometimes medical professionals don't realize what's actually happening with a patient, and trying to get them to understand is not necessarily always the easiest thing, because they're not living it day to day.
So that was a bit of a wound, especially when, you know, hey, I know when I look tired. I don't need somebody telling me I look tired.
Right. And I don't need somebody telling me, "Hey, your leg looks bigger today. Are you okay? Are you walking? Because you're walking differently." You know, and I used to never be afraid to have my compression out. And now I'm in the mode of I need to hide my leg because it's gotten so much bigger.
Okay, so what can we say to help Katherine? Because we love you, Katherine, and we think that you just raised something that a lot of people that have logged on face themselves. So patients, medical professionals, what advice would you give Katherine dealing with this challenge as her body is going through a change? And we know that we will get it back to where it was and even better. But what would you say to our friend, Katherine? Oh, well, okay. Yeah, that for sure. That for sure.
I mean, it's hard to, oh, sorry.
But no, please do.
Well, I don't want to fall into the exact thing that Katherine was just describing about being helpful, intending, you know, to be helpful and not being actually that helpful. But I think generally speaking, you know, just encouraging you to keep on keeping on through this. And as we all know, attendees and panelists alike, lymphedema changes daily. We have to adapt constantly our treatment or, you know, our diet or this or that for it. So kind of rolling with the lymphatic flow or lack thereof sometimes, but trying to get it, you know, kind of, you know, I don't know. I don't want to not be helpful.
No, I get, you know,
in this moment, but
yeah.
I don't want to give advice not knowing your full situation, but definitely just encouraging you to keep on with it, because it it sucks, you know, it really sucks that we can't control this like we would like to, you know, it's not a one-to-one kind of thing, unfortunately, but
Yeah,
you've
and
got a
people
whole,
are well-meaning. They really
Yeah.
are, but sometimes it's like, did you really have to ask me that?
well,
You
it's
know?
like when a little kid falls down, they're fine until somebody starts fussing, and then they start getting like, you know, something's
Yeah,
wrong.
great
So-
point. So I have Kelly and Angela. Go for it.
You know, I know Katherine's situation, and it's hard. It really is, because she's got a light at the end of the tunnel, and they're really taking very slow. And it's something like a scheduling. I'm gonna lie to you. And so you're like, can you just give me the light? Like, can you let me know there's going to be a resolution here? And I'll be honest with you, dealing for 17 years, the medical community is not necessarily as responsive we'd like them to be. Okay, they're rarely, just to be honest. And so, because they don't understand the impacts that this is causing. And so, about the best I can tell you is like, all I do is like, I pretty much expect the worst and just like live in this moment and just do what you can do. But it's hard when you're getting worse though. And I feel for her, and then just know that there are people who understand what you're going through. I guess that's the best thing. Cause when you know you're not alone, I guess that
Yeah.
like, I think all of us who've had it, live it. And we just keep doing the best you can, Katherine, and we're here to support you.
We are, and you need any encouragement, you call on any of us. We are right
I
on it.
know. Well, I can tell you, you know, in this past, since we met last, I had one of the best privileges that some of you may have seen on social media. I don't necessarily know that Kelly was thrilled that I posted the picture that I did, but I got to meet Kelly in person in April, and I got the biggest bear hug ever. So, which was absolutely awesome because he knew I needed it.
Oh, I love that. I love when we move out of the virtual and into physically, getting to know each other. That's awesome. I love that, Katherine. And we have some questions coming in from the audience, but I want to get to you, Angela. You wanted to jump in on this topic.
I'm going to preface it with saying this may not sound good, but
Okay.
I believe that, you know, you mentioned that people are constantly saying, are you okay? Are you this? Are you that? I believe in just saying to people, you know, I really appreciate your concern, but do me a favor. Don't ask me about it so frequently. I've had to do that because after a while, I don't need the reminder. It's like you said, Brenda, I already know. I don't need the reminder. And I believe in educating people. And I believe in, if someone continues to say, you know, are you okay? How's your leg today? Your leg looks bigger. You don't need that.
Yeah.
I believe in you know, I really appreciate you asking, but you don't have to so frequently.
That is such a great way of putting it, because you can say the same thing in a negative, defensive way or in a positive of affirmation. You know, I wish you wouldn't ask me that, or I appreciate you asking me that. However, it's not really helpful. You know, just in the way you say it can make such a difference. So that's a great point. We have a couple questions from the audience. Mary Lou Ramos, we're so glad that you're with us tonight, Mary Lou. She asks, what is the best diet for lymphedema? And boy, do we wish we could say there was one answer, but the answer is, Karen, would you want to jump in on that? And I know Kelly has some information on that too.
I would love to jump in on that, because I think that we are all different people and we all need different fuel mixtures. And in general, most of my lymphedema patients and lipedema patients say that eating the white foods causes fluid retention and makes them feel like crap. So the sugar, the starches are generally not people's friends in large amounts. But having said that, I have people all over the board, from keto to paleo to, you know, even vegetarian. I have people doing carnivore. And I think that what happens is that you gotta find the foods that make you light up, that make you feel like you can conquer the world. So it's about maybe keeping a food diary and tracking. What are the foods that make you feel like you can go all day long? And what are the foods that rob your power from you? Because foods are a real huge issue for all of us. I mean, it's nurturance and it's pleasure in addition to just fuel. So it's a loaded issue. And I'm here to say that everybody is different, and there is no cookie cutter diet. And but finding the right fuel mixture makes all the difference for many, many, many of my patients.
Great expression of a very complex question in a way. We don't know you, only you know you, and you know what feels good to you. And I love that advice about maybe tracking and saying, hey, when I eat this, I feel like, bleh. But when I eat this, I feel good. I feel up. That's excellent. Kelly, you've recently made a change in your diet.
Yeah, I will tell you this. I went vegetarian for years, and believe it or not, I kept getting worse. I mean, I was bad. And then I went keto, and for me, and I think it was because we like to lump lymphedema into one group. Well, my lymphedema is caused by my damage in my central area. And so when I went keto, it really flipped the switch in my body. And because where I'm damaged, this is a question I've asked, and I still to this day can't get an answer because it takes a while for the fats and my fat soluble items to get through my thoracic duct. And that's where I'm blocked. So how does the food get from my mesenteric to my thoracic duct, to my organs, to the liver where it needs to be processed? And so I do get some fluid through there. And I actually use the pump to get some, but I recently switched to carnivore because there's more nutrient dense in some of those foods, and I'm trying it. And so far I've been keto for 5.5 years. So if someone tells you it's not sustainable, it is. And I had a lot of success on it. I'm trying carnivore just to see if it'll improve some more. And I've been out for a little week and a half, and it actually is helping.
People just watching and may not know the distinction between keto and carnivore, in a nutshell, it is.
Okay. Keto focuses on low carb and high fat. Carnivore, you really are eating meats or eggs and cheese, which I don't do the cheese, and fats. That's the only two things, because believe it or not, in those meats, there is nutrients.
Yeah.
And nutrients enough to sustain your body. So
well, it's everybody is different.
Right.
Angela, you did a post this past week that I was in love with, a bowl of fruit I trust. What the heck did you mean by that?
Well, for a long time, I was so afraid of fruit because of the sugars. And over the years, I've realized just what Karen and Kelly just said. You got to listen to your body. And when I realized I could eat fruit again, I was so happy. But there are only certain fruits I can eat. So it just goes back to, you really have to feel your body. You have to listen to your body, because it will tell you through inflammation or swelling or pain or however it decides to tell you if you've gotten into something that was not conducive to a good feeling. So I eat my fruit now, but I'm careful about the fruits that I eat. And the ones that are not good for me, I stay away from them.
Got it. Well, I want to mention John Hershinger, who's out there. We just appreciate you, Mr. Hershinger. He said, I struggle each day, but I just built a porch overhang flopping like a fish with all the porch railings. And now I'm building a new master bathroom. You can do it. Well, I don't know if I could do it, Mr. Hershinger.
You just do it differently and maybe slower.
Yeah, exactly. I'm impressed and inspired, and I love your spirit, because there it is. You can also have a positive mental outlook, and that can so help you physically as well. This is a really good question, and I'd love everybody to weigh in. Sherry Brack, we're so glad that you joined us, Sherry. Thank you. I am new to the lymphedema world, she says. Are there triggers? And if so, how do I head them off? Anybody want to weigh in on triggers? Go for it. Go ahead, Katherine.
So one of the things I was actually going to add in about the dietary thing is going to work here too, which is that sometimes what you think is working for you can take a very quick, abrupt turn and no longer be a food that is agreeing with your body. And you have to slowly eliminate that, basically, to try to figure out what is causing the new potential inflammation. So sometimes, you have to really kind of watch and see what's happening. Is the swelling changing? Is there more pain? Is there more heaviness? Is there a difference in the way you feel overall? And then try to eliminate those particular foods, that you that you've recently had to try to eliminate out and figure out what is the causing factor and go from there to avoid that for a while until you think you're okay to try to wean it back in, but it may not work. So, if you go back to those symptoms and it's that food, and you really have to kind of go with the avoidance of that food for quite some time, and you may not be able to bring that back in depending on how your lymphedema is reacting, because Kelly's lymphedema may react differently than mine does versus Alexa or versus Angela's. We all may react differently depending on how our body is functioning. So if I decide that I'm going to follow the same diet Kelly is following, it may not work for me. So I have to modify it to work for me. And it's like a trial and error kind of thing.
So it's individual. And I love your answer there, but I want to see if there are other triggers other than food that could help to answer this patient's question as well. Alexa?
Yeah, so sitting for long periods, gravity, I know a lot of us experience this. I work remotely. Before, when I worked in an office, I had my walking to the bus stop, walking to the, all of that movement, walking to the break room. I don't have that anymore. I'm just at home all day. And that was really, really literally weighing on my leg. It was getting super dense and heavy. And so I got a standing desk converter, and for like 30 or 45 minutes every couple of hours, I'll stand and do my work. And I found that really helps me. And I posted about it on my blog's Instagram, and I got a lot of comments from people that were like, oh my God, no, standing is a trigger for me. I can't stand like that, and so it goes to show, it's different things for everybody. And like everyone else was saying, it's really kind of listening to your body. I know as soon as I eat a certain food, like salt for me is a big trigger. As soon as I eat something salty, I feel it in my leg immediately. And when I used to drink, I would feel that in my leg, and I haven't drank now for a very long time because that was part of it. But so certain things, just being really in tune to yourself and not ignoring those signs, and kind of making a mental note or in your notes app on your phone or in a scrap piece of paper, just write down when you notice something and kind of see if there's a pattern. That can kind of help too. But just really listening to yourself and not, discounting things as just a fluke thing or whatever. Like, pay attention to it and see if it happens again. And then it might be a trigger. So yeah.
It might be a trigger. Now, the last time you were together with us, I believe, Angela, you were in a much more humid place, and now you are in Arizona, aren't you?
Mm-hmm.
Do you find that the weather can be a trigger?
I do. In Arizona, I think right now we're in triple digits now, but the air it's dry heat. When I go back home to North Carolina, it is certainly not dry heat. And that heat in North Carolina tends to be more of an aggravating heat for me. But another trigger I find too is just simply the fact that I even have the diagnosis. Sometimes I look at the fact that, oh my God, why do I have this? And it triggers me because I'm doing all the things I can to fix it or make it better. And sometimes those fix-its don't work. And I get angry that the fix-its are not working. And that's a trigger for me. I'm going, what's the point? I just do what I want to do. And I have to pull myself back. But just the condition itself is a trigger for me on occasion.
Thanks for sharing that. And I think a lot of people can nod their heads and say yes to that. Kelly, did you want to weigh in on triggers?
I think she hit it right there. It was stress, anger. That's my worst. I can honestly tell you, if I get in a stress or mode, within just a few minutes, my hands, I don't work, my arms will start swelling. And so that adrenaline kicking through your body when you're not needing to fight or flight is not a good thing. So that's why I try to tell people, try to find and maintain your peace and let the little stuff go. And
so our friend John Hershinger just said, is everybody from North Carolina? And we say, no. I'm from Sarasota, Florida. Who else is from where else? Tell us where you're from.
I'm from New Jersey.
New Jersey, Betty.
I am in Central Arkansas.
And Alexa?
Baltimore, Maryland.
And Karen?
I am stuck in Lodi, California.
Oh, I don't know if that's stuck. I like that West Coast vibe out there. It's awesome.
It's a famous song.
Yeah, yeah. Oh, and John came from Naples, Florida. So we're almost neighbors, John. How about that? We've got Orlando, Florida in the chat here. Everybody's telling us where you're from. We got Houston, Napa, Shanna. I want to be where you are in Napa, Cincinnati, Ohio. Australia, Sarah Williams. Wow, you traveled the furthest to be here tonight. And Jeannie's in North Carolina, Brandon, Florida, Teresa Fitzgerald. We're also not too far from each other. Massachusetts. We thank you so much from all over. That's the beauty of Zoom, that we can all be together, even though we're all very far apart physically. There's another Florida person, Lourdes, thank you. And Juanita Rankin, Bridgeton, New Jersey. It's lovely to hear that you're out here at the roundtable tonight. How awesome is that? We did get a question earlier in chat about the progressive nature of lymphedema. Is it a progressive condition, was the question. And I would love to yield to either Betty and Karen about that.
Yeah, I feel like
Go for it.
in most articles and textbooks, when you look up lymphedema, it is described as chronic and progressive, meaning long lasting. And I always tell people it's progressive without management, but you can manage lymphedema without it progressing to different stages. But while within those various stages, you can have various levels of progression, if that makes sense. So it's almost like you have stages and then sub stages or subcategories. Because like we were just talking about triggers, you may be a stage 2 lymphedema patient, but you could have better days and more impacted days where you're feeling heavier or more fibrotic. So yeah, I think that progressive is probably an appropriate term to use there. I think it's most often used in articles and in textbooks and things like that.
Karen?
So I would say that to every patient that I see, I say, let's see if we can put your lymphedema in remission. Let's see if we can control your symptoms so that you can live a full life. And technically, yes, as Betty said, lymphedema can be progressive and you progress through stages and you get to stage 2 and stage 3 and they have scary names like irreversible. But I have to say that 2 weeks ago, I got to observe a surgery that Dr. Wei Chen did in Cleveland. And oh my goodness, we can't say that lymphedema is irreversible anymore because with the new surgical techniques, it is totally changing the picture of lymphedema and chronic swelling. So I think there is so much hope out there. And it's just connecting with the right people that can help you get to where you want to go.
I love that message of hope. That's what we're all about at Lymphopress too, because if you can manage your condition and stay on top of it, and, you know, I hear stories from so many patients. In fact, Ann Smith just wrote in the Q&A, I was a bad patient. I didn't pump for 2 months. And see, we want to really encourage you. Many of you received an invite to this roundtable because you have been prescribed a Lymphopress, and we don't want to just give you a pump and say, now have at it. We want to encourage you to make it a part of your life, to use it regularly, because when you do, you will see that you can stay on top of this. I mean, this is one thing that you always talk about, Karen, about doing your pneumatic compression pump. That's why you have it, to help forestall the progression of your condition. But let me tell you Ann's story. She's doing a true confession. She must have thought that she was in confession, because here she goes. I was a bad patient. I didn't pump for 2 months. Her legs swelled terribly. Then her feet began to hurt, pain that was unreal for her. Has anyone had this intense pain, top of feet and just standing on them? And Marilu Ramos stepped in and said, I have it in both legs, and shaving is a trigger. Summer is here and hairy legs. or not. That was pretty funny. That was, we love that comment. But so she didn't pump for 2 months. Her legs really swelled and then intense pain. Anybody want to comment on that or help encourage Anne?
And you can jump right back on the horse. And, you know, for many people, some people can't do this, but many people can pump more than 1 hour. And I have people that will pump 2 or 3 hours when they get home from a trip because they've gotten off the airplane and they feel really swollen. Now, if you have heart or liver or kidney issues, or if your therapist has set a hard stop to how much time, then you need to be really careful. But for most people, your bladder is going to stop you before anything else. So I would just jump right back in.
That's really good advice for anybody. You know, you may have fallen off some sort of wagon, whatever your particular wagon is. You can get right back on. Go ahead, Kelly.
The times I have this is when I like do more than or if I don't treat it at all. But if I do too much and I start getting swelling, I was talking to a friend of mine that, believe it or not, is pregnant. A lot of the same issues with the baby pushing on all this, but she was talking to me about her feet and how it hurts. And they were like, oh, telling her that the bones move. And I'm like, when you get fluid down there, it does do that. And so it does hurt. And so for me, there's twofold to this. It always comes back to my, what I'm eating and then also maintaining it. And so when I have it and it hurts to pump, I just reduce the pressure for that pump session to where it doesn't hurt, but you just have to get that fluid out of there slowly and then get that fluid going before, because like for years I couldn't walk. So.
And look at you today.
Yeah.
Yeah. Yeah. You're quite active and very mobile and awesome, Kelly Bell. A few comments in chat that I want to just note. First of all, Sarah Williams finally got her Lymphopress and she's waiting for her garments. So we're excited for you. We can't wait to hear how much it's going to benefit you. And you should look forward to it. It's great. And then Israelia Benjamin said that on the 12th of May, it will be her 1-month Lymphopress anniversary. It's the first time she's ever had a pneumatic compression pump. Happy 1-month anniversary. You will find that with each passing month, it's going to help you so much. And we are here to root for you and cheer you on. Chu Jun Richard picked up on something that you said, Karen, about the bladder. And he's like, wait, what's this about the bladder? You said the bladder will tell me when it's time to stop pumping. And we sort of know where this is going, but please do share, Karen.
Well, I've been typing like crazy in the chat here because, and this is funny because this came up in my clinic today because one of my patients is on a diuretic. And so he goes to the bathroom right before he has any type of lymphedema treatment. And I reassured him, I said, you know, we can actually take a break and you can use the bathroom midway through. And for some people, you need to use the bathroom halfway through the Lymphopress treatment. That's fine. It's about listening to your body and figuring out what you need.
Excellent. In fact, listening to your body is something that's a common theme throughout tonight's roundtable. Terry Zins mentioned that sometimes when she's on the pump, she experiences pain, and that's a signal. And if you're experiencing pain, what do you recommend?
Talk to your therapist, consider turning the pressure down a notch, consider doing less time, try to find that sweet spot. But I would really seek a little bit of guidance because if you're having some pain and you didn't before, then that might be a reason to talk to someone on your medical team.
Yeah, don't just, push it under the rug. This is exactly the kind of thing that you want to talk to your medical professional about. And so we encourage you to do that. Listening to your body is so important. I'm seeing this over and over again. Jeannie Proctor wanted to know about the amount of compression level settings that can be used to help break up fibrosis. Now, would you add the caveat, follow what your doctor has prescribed first?
So I'm not going to give any specific levels because Jeannie, love you, but you're not my patient and I don't know your body. So this is an individual thing. The doctors prescribe the pressure and it's usually on the recommendation of the therapist or another medical professional. So having said all of that, I'm the fibrosis queen and I
Yep, she is.
love pneumatic compression because it helps to soften hard tissues. And a lot of times when you have fibrosis, when you have hardening of tissues, there's swelling trapped inside, and it's really hard to get that out. So using Lymphopress is an amazing way to both soften fibrotic tissue and to help to decongest very fibrotic tissue. So Jeannie, I'm not answering your question the way you want, but it's something that is possible, and definitely reach out and get some guidance from your medical team on that.
Great answer. And Chujun had a follow-up about we always have some bathroom talk in every roundtable. It would not be a roundtable if we didn't talk about going to the bathroom. Newly diagnosed has many questions. Do lymphedema patients experience an increase in urine? And actually what it really is when you're using the pump, you're eliminating. So that's why you may notice that you're going to the bathroom more. Did I answer that properly? Anybody correct me if I'm wrong? I see nodding. So that's really what that's all about. Linda Lehman says, is the therapist you mentioned the Lymphopress agent? Oh, okay. So great question, because you mentioned the therapist. So Lymphopress and our team, we work hand in glove with amazing medical professionals. We do not take the place of them. Your local rep can help advise you about your pump and help to encourage you to implement your doctor's orders or what your therapist has recommended. But when we say therapist, we are talking about a lymphedema therapist, a certified lymphedema therapist, maybe a physical therapist, someone that's working with you to help you manage your condition. And then the Lymphopress team is an extension of that. We like to consider ourselves an ancillary part of your doctor's office or your therapist's office. So I hope that that helps to make that distinction there. So we are running out of time, and go ahead, Kelly.
Can I talk about Learn?
Yeah, go for it.
Okay, Sunday is the Global Run Walk to fight lymphatic diseases in Boston at the what's it called? The park in Boston. Artesini Park. I don't know how to pronounce it. In Boston. It's Sunday, May 15th. The registration starts at 8. So if you want to be there, I'll be there. So I'll be in Boston this weekend. And then Monday, the virtual ceremony is going to take place. And Steve Gutenberg is the master of the ceremony. His mom actually has lymphedema. And you can go to www.lymphaticnetwork.org to get more information.
Fantastic. We're glad you mentioned it. Yep. Thumbs up on that. So with just a few minutes left, I want everybody at the roundtable to think about the best advice someone has given them to help encourage them, whether it's about lymphedema or whether it's about anything else. The best words of advice you've ever been given. And since I just threw this on you spur of the moment, I'm going to start with something my sister told me. 4 words: this too shall pass. And basically, the context for that was, you may be going through a tough time, but this too shall pass. When you look over your shoulder, you think about all the things that you have already survived and thrived, and maybe things that you thought you would be down for the count, and here you are. This too shall pass. And then on the other side, the good times, this too shall pass. So savor them. Those special times with family or friends, those days where you just have a giggle or a spring in your step, or you're feeling happy and full of joy. Know that this too shall pass, because life is a series of ebbs and flows, but nothing is forever. So you will get through this if it's a tough time. This too shall pass. That's my sister, Shirley DeBacco. I always go back to that advice. Who wants to talk next? best advice given. Go ahead, Alexa.
I do.
All right, Alexa and then Karen, go
A
for it.
birthday girl can go first.
Oh, thank you. So I really want to piggyback onto what Brenda just said, is that we are so much bigger than the immediate situation. If there's something that we're going through, big or small, who we are as a person is so immense. And our problems are just little speed bumps. So I think it's about keeping it in perspective.
I love that.
Go
That's
for it,
good.
Alexa.
Thank you. That was great. I forget who said this quote, but, and it sounds a little glib, but I think it's a really good one. It's, we either make ourselves miserable or we make ourselves happy. The amount of work is the same. And I think it kind of brings you back to this place of autonomy, of like, and kind of relating to what you both said as well, you know, realizing that whatever we're going through, it's going to pass, and how we engage in that feeling or in that situation, that's our choice. We can make that choice. So just kind of weigh that, you know, and hopefully that helps.
That is really good. Who else wants to jump in? And I'm answering some questions that we can't get to, mainly because we're not offering medical advice at this time, but we do recommend, if you have questions, ask your doctor, ask your medical professional. And you can definitely ask questions of a vascular doctor. Often veins are very integrally involved with your lymphedema, and why your legs and feet turn red. Is there somebody that wants to answer a quick one on that one for Mary Lou? Why do your legs and feet turn red?
It could be a number of things. So if it's before or after pumping, that would make a difference. I would definitely say probably get a medical opinion or checked out in person.
Yeah. Okay. That's exactly my advice too. So good. I'm glad that, you know, I didn't want to, we value your questions and we love hearing from you, but we also don't want to step outside of the realm of what's appropriate for us to talk about here too. So Betty, while you got the mic, what's your best advice?
Well, I've been sweating over here trying to think of what to say because I go blank in moments like this, but I remembered it. And this is what helped me launch the podcast and Camp Watch Me and a whole lot of stuff, because 2019 for me was a big, scary year. And there is this coach or teacher, I don't know what you want to call her. Her name is Christy Wright. And her advice was, but do it scared. If there is something that you feel called to, you feel passionate about, you feel just, you can't stop thinking about it, but you're scared, do it scared. Don't let the fear intimidate you or keep you from trying. Just do it scared.
I love that.
I do a lot of things scared.
Yeah, me too. And someone said to me, instead of saying it's fear, say, I feel excited. It changes everything instead of being afraid, right? Katherine, did you have best advice someone ever gave you?
I do. It's actually a quote. It's one of my favorite quotes I've ever seen. It's actually by Winston Churchill. And it is, success is not final. Failure is not fatal. It's the courage to continue that counts the most.
Yep.
I don't know about you all, but I'm feeling encouraged. And from the chat, I see that it's hitting the mark with our folks out there. We're so glad. Kelly?
I will tell you, I'm a control guy. I don't like to see people suffer. That's why I joined the Coast Guard. And one of the things I found to help me take control of this and try to help people is I literally joining Learn, becoming part of that, becoming an advocate, help me find a little bit of control, or at least like I'm trying to make a difference. I'm trying to help not just myself and others. Learn's mission goal is to cure lymphatic diseases. And I will be honest with you, I will be the happiest guy when we no longer have to have these discussions.
Well, we'll have a big party because we won't have to have a round table anymore.
That's it.
Oh, yeah, there you
We
go.
can all retire.
Yeah, but we'll all still want to get together and talk. So your advice then is to plug in with something that feels meaningful and like you're making a difference. I love that. Angela.
The advice I got came from my daughter, my precious, wonderful daughter, who is oftentimes considerably smarter than I am. She's told me, don't define yourself, by your disease. Define yourself as one who's managing a condition.
And as my wonderful Alexa taught me, you are not suffering with lymphedema, you are living with lymphedema. So to all of you, to your lives, to good lives, to making your life better, we hope that this hour helped to encourage you and make your life a little bit better. We here at Lymphopress are so honored to work toward that goal. And thanks again for giving us a bit of your time. And thank you to my wonderful panelists. You rock. You're amazing. Another hour went by really quickly, and we send all of you so much love and appreciation. And we're cheering you on all the way. Have a great night, everyone.
Bye, everybody.
Bye, everybody.
Bye.
Bye.